Across the world, Kenya is no different. Innovations from Kenya, however, to tackle the pandemic have put the country and Africa at large on the front line in terms of technology and innovation in the wake of this pandemic. Let's speak now in an exclusive interview to Jane Marriott. She is the British High Commissioner to Kenya, also having served as a director for Joint International Counter-Terrorism Unit in the Home Office. Previously, she served in the Middle East as well as North Africa in the Directorate of the Foreign and Commonwealth Office and the High Commissioner to Yemen between 2013 and 2015. Quite a profile there. Many thanks for joining us, Jane, on Bottomline Africa today.
Thank you. Great to be with you, Michelle.
Relationship between Kenya and the UK, most of it having been cemented by technology. The UK did set up a UK-Kenya tech hub not too long ago. How is that doing so far?
So the Tech Hub is doing really, really well. It's a virtual launch. It's not the hard launch that we had hoped for, but COVID has changed a lot of things in the world. But we're supporting entrepreneurs to connect to 3D printing, big data, artificial intelligence, blockchain, and then crucially using their innovations to connect to micro, small and medium enterprises to help them grow as well. And what's really important is that something like COVID is going to exacerbate the differences and the inequalities in this world. And so having this science and tech and innovation with great responsibility to use this tech to make the world a better place for everybody is really, really important to all of us, British and Kenyan people.
And like you mentioned, I mean, the bigger conversation and the bigger concern about the rise in the use of technology in the wake of COVID-19 is the population that could be cut out because of inaccessibility or lack of access to technology. The UK itself has been involved in charities in fighting coronavirus in developing countries. What are some of the efforts being implemented in Kenya to ensure that marginalized population is included?
So starting off globally, the UK is putting nearly £1 trillion Kenyan shillings into finding solutions around vaccines, around vital humanitarian relief, cash transfers for the poorest, and in particular some of those people who have been recently impacted by COVID, who had day jobs beforehand, strengthening global healthcare systems, and also the secondary effects of COVID, so helping mitigate some of the worst effects of that economic downturn. Here in Kenya, feeling the benefits of all of those things that we're doing globally, but also specifically through British businesses. So tens of thousands of litres of hand sanitizer are being brought to the Kenyan people from British supported companies like Unilever and Diageo through East Africa Breweries Limited. And then on a very local level, so we've also done some charity fundraising within the High Commission for Mama Kwa Mama charity to support mothers.
Let's talk about how we can get young people involved in this. I mean, listening to briefings from the Ministry of Health, young people, make majority of the population. They are the carriers of the COVID-19 pandemic, really. How is the UK Kenya Tech Hub helping young people become community ambassadors in the fight against COVID-19?
Oh goodness, a whole variety of ways. This morning I was involved in the end of the Kenya Hackathon. So this is a hackathon to try and promote tech-eye solutions around health, food security and dignity at work, all really, really important things to people. So we had 300 applications, whittled that down to 10, 4 prize winners to come up with solutions in a COVID-centric way to support Kenya. We're supporting something called Gumzo, which is a local version of Zoom. If you haven't heard of it already, please use it instead of some of the more mainstream rivals. Many of you will have heard of Shujaz, which is a multimedia platform to help young people stop the spread of disinformation and get accurate reporting out there, because there's a lot of information out there and a lot of it is just simply scaremongering. And then you haven't heard of it yet, but I hope at some point you'll hear of Safari, which is a contact tracing platform app, which is currently with the Ministry of Health, but it means that if you've got COVID, you know somebody who's got COVID, it will help them track all the people they've been in contact with so we can stop the spread of this disease this virus going any further. So lots of innovation, lots of great ideas coming from Kenya's young people.
Absolutely. And many would say the innovation coming out of this really is a silver lining in the COVID-19 pandemic, at least in Africa. We've seen, ventilators being manufactured or produced in the country as well. You also support the Science and Innovation Network. Tell us a little bit about that and how all this innovation we're seeing coming out of Kenya and Africa can be leveraged on, and especially the innovators to benefit from this.
So we very much believe in partnering with Kenya for Kenyan solutions, not just for Kenyan challenges, but to give Kenyan answers to problems that the entire world is facing. But certainly locally through something called the Newton Utifali Fund. We've been supporting Anthony Mathungu, who you'll hear soon as the guy who's developed the prototype ventilator here in Kenya. We've supported 13 other Kenyans who are currently, with sort of 3D printers and grants, who are currently making protective covering for frontline healthcare workers, because they're the people we really need to protect in this current virus. And the Kenyan Cabinet Secretary for Education and I met a couple of weeks ago to go through a whole range of science, tech and innovation partnership that we're doing together here in Kenya. Not just on COVID, obviously a lot of it's been reoriented around COVID, but the main impact is going to be the secondary effects that are felt by people across the world, the economic impacts, the security impacts. And food insecurity is something we really worry about, which is why I'm so pleased that we can support Mazawe Plus, who are working up in West Pokot with dairy farmers on innovative solutions about tracking record keeping around milk, temperature testing of milk so it doesn't go to waste, and they're saving an awful lot of milk as a result of this innovation.
The healthcare system itself has undoubtedly come under a sharp spotlight since COVID-19, many terming it as a failed healthcare system. Take us to some of the key initiatives that the UK government is implementing in Kenya, specifically in the healthcare sector.
So specifically, it's actually our main thing, I suppose, is more global, but with repercussions for Kenya. So vaccine. We're only going to get back to whatever the new normal looks like once there is a vaccine for COVID or the various strands that develop from it. There's a global race at the moment to get a vaccine, and what's really important to us is that it's a vaccine that is safe and that it's accessible for everybody. It's affordable for everybody. It's not one of these vaccines that ends up in the hands of big pharma. So Oxford University, for example, has been working with KEMRI for about 3 decades now. So Kenya is very much part of the solution for vaccines, and I know that's controversial, but it's really, really important that Kenya is part of the solution as part of a global problem, and that will be great for Kenya's profile. The UK also helped in 2016 in anticipation, frankly, of global emergencies. We helped set up the Public Health Operations Centre here in Nairobi that's been at the heart of much of the government's response. And the UK is also hosting on the 4th of June the Gavi International Vaccine Summit, because whilst we're very much focused on a solution for COVID right now, we need to get all the other vaccines rolled out to people. All the deaths that we get from diseases that are currently inoculated against routinely, the deaths from those are going to be even higher than they are from COVID unless we can continue to roll out the global vaccine programme. So an awful lot of work done by an awful lot of very smart people, and I'm really proud that we can be supporting Kenya in this battle.
Even as COVID-19 continues to have an impact on economies across the world, the economy in Kenya as well, what is the state of the current trade pacts between Kenya and the UK, with concerns that many of these trade pacts would be cancelled in the wake of the pandemic?
So we and the East Africa community are looking to negotiate a free trade agreement by the end of this year. Timeline's now quite tight because we hadn't factored COVID in, but I'm fully confident that we can keep trade going between our two countries. And indeed, we've still seen sort of flowers, horticultural going to the UK, goods coming back into Kenya. That international trade is really important for both of our economies, and we'll keep it going.
Many thanks. That is Jane Marriott. She is the UK High Commissioner to Kenya there, speaking to us about the efforts of the UK government in partnership with the Kenyan government really in combating the COVID-19 pandemic. Most of their concern there being on technology and innovation. Many thanks for your time, Jane.
Thank you.
To other news, and now the head of the World Health Organization